Taoiseach, the Taoiseach launched a really cynical, politically motivated attack on the public health team in order to cover over the government's failure to use the summer period to resource our ICU to the level that we need, our hospitals generally, and a tracing regime that would allow us to chase the virus rather than be chased by it, which is currently happening. But regardless of the cynicism of the Taoiseach's attack, if infection rates continue, even at the level they're at, but as is predicted now by the modellers of NPHET, get worse, the economic, human and social damage will be even worse. Now, if you are going to deal with that situation and take the measures that will be necessary, one way or another, to protect public health, you are going to have to protect the incomes of working people. The taxi drivers will be out on a drive, socially distanced protest this Friday, but in their thousands, because along with other groups, you have slashed their PUP payments, forcing them back to work when there is no work, along with the events, the arts, the music people, of course, bar workers, hospitality workers. You have effectively, from a financial point of view, stabbed them in the back at the time when they need support. When you've lifted the eviction moratorium and the mortgage repayment moratorium that would have allowed them to survive this period, you have failed to give them support, and you've actually reduced their supports. Now, we have a motion tomorrow in this House calling for the restoration of those payments. And the issue is, Taoiseach, are you going to do that? Whatever about our dispute with you about restriction levels and so on, if you want public compliance, you cannot do anything other than restore the income supports for people who've lost their jobs as a result of this pandemic. Are you going to do it, Taoiseach?
7 minutes over 3 minutes remaining.
Well, just to say in the first instance, again, I have to resist the attempt to underplay and undermine the progress that has been made within the health service in terms of ramping up key aspects of it, particularly in terms of testing and tracing. It's been quite significantly enhanced. 100,000 weekly now onshore laboratory capacity. That's what we have today in the state, and 2,000 per day offshore. And we're currently increasing capacity onshore for November and December, and we'll continue to have offshore capacity during the winter period. So there's been a very significant ramping up of the testing situation. And also in terms, 90% of our tests are completed end-to-end in less than 3 days. Over 91% of GP referrals get an appointment in less than 24 hours. Over 95% of people get the result in less than 48 hours from swabbing appointment. And overall, end-to-end, the referral to the end of tracing median is less than 2 days. So there has been very substantial progress, and it's time to acknowledge that. It's not where it was in March. It's far better, higher volumes. We're testing far more now than we did in the earlier part of the pandemic. And that has to be accepted. In terms of the hospital system, there's been a 30%, when the winter initiative is implemented, increase in ICUs, 25% since March, and a further 17% as a result of the winter initiative. And it will be challenging to get the staff. But the funding has been made available. It's the largest ever funding initiative for a winter initiative ever in the history of the health service, designed to try and increase capacity, both on the ICU side and also on the general hospital side, staffing, and in terms of releasing frontline healthcare staff who had come to the rescue in the early phase of the pandemic, to get them back to their frontline services. There's very substantial recruitment is now underway, and as I said earlier, in terms of contact tracers and swabbers, is making very significant progress on that front. And in terms of private sector capacity, there was no proposal left on any desk. HSE had been continually negotiating an ongoing negotiation. There's a bridging agreement, 25 million. They've completed a new agreement, procurement agreement, which will deal with diagnostics and general services, and they're ongoing then in terms of the need in relation to a surge. And in terms of the pandemic unemployment payment, that was meant originally as a 12-week provision. It's been open to new entrants, so anyone who's laid off as a result of going to level 3 will be able to avail of it, and it's been extended out to April of next year. And again, the government has to look at beyond April of next year to make it sustainable, but also to look at other social welfare recipients. Of 213,000 people on job seekers allowance, on 203 a week, carers allowance, single parents, lone parents, in terms of their payments, the whole area of child poverty. There's a whole range across social protection that we've got to look at as well, in addition to all of the other commitments. And it's interesting, you know, I think deputies are having an each way bet. On the one hand, you know, Deputy MacDonald talks about because of a government decision, there's thousands laid off in hospitality. It's COVID has forced that decision. Government doesn't willingly lay off people or cause sectors to close. Others in the House will say you should have gone to level 5, which would have meant hundreds of thousands of people laid off overnight. And these are the calls and the choices that government has to make.
Which is question number 6.
The budget will deal with the budget will
afraid.
deal with, hopefully, with some of the issues that you're referring. I can't preempt the budget today, and I don't intend to.
You can't answer the question.